Hello, thank you for meeting with us today to hear our proposal to address vaccine hesitancy and equitable distribution of the COVID-19 vaccine in Japan. Japan's response to COVID-19 included a relaxed lockdown and no broad testing policy. Their national healthcare system and public health network, alongside high mass compliance, resulted in low initial death rates. Japan has the highest rate of vaccine hesitancy mainly due to the fear of side effects, lack of efficacy, and reliance on traditional medicine. Studies show that directly targeting under-vaccinated populations and engaging trusted and influential leaders to promote vaccination are the most effective ways to decrease vaccine hesitancy, which are key components of our program. The Forward Project will decrease levels of vaccine hesitancy, increase vaccine accessibility, and achieve herd immunity in 1 year. To achieve these goals, the Forward Project employs a nationwide grassroots phone call campaign and VaccAdvise app. In conjunction with existing hospital vaccine distribution, VaxBans, and temporary vaccine clinics will improve vaccine accessibility to hesitant, isolated, or immobile individuals.
The timeline for COVID-19 vaccine eligibility will begin immediately with any remaining unvaccinated healthcare workers. The next priority group, citizens aged 65 and older, will be eligible in April, followed by people with chronic illnesses and the 60 to 64 population in May. The last group will be able to receive the vaccine starting in June and includes any person aged 16 and older. Combined, there will be enough Pfizer, AstraZeneca, and Moderna doses available to fully vaccinate every citizen of Japan while accounting for lost or damaged vaccines. The Forward Project will achieve vaccination success in 3 phases. Phase 1 will focus on hiring professional recruiters who will be recruiting local health providers, religious leaders, and traditional healers. In addition, VaccAdvise app development and VaxBand manufacturing will begin. Phase 2 will involve training phone campaign volunteers as well as clinic and van personnel. Supplies will also be distributed to the clinics and VaxBands. In Phase 3, we will implement the phone campaign and launch the VaccAdvise app. Online town hall meetings where people can hear from a panel of medical experts, religious leaders, and traditional healers about the COVID-19 vaccine will take place. And finally, clinic staff and van drivers will be deployed.
The premise of the Forward Project's call campaign and its mission to decrease vaccine hesitancy relies on relationships between leaders in the community and the general population. Recruiters will target leaders with strong ties to the general public and their communities. Once trained by our staff, these leaders can have multiple conversations over the phone with their community members over a short period of time to convince them to get the vaccine.
We will train the community leaders by teaching them about difficulties they might encounter when talking to individuals about the vaccine. They will answer any specific questions or concerns that individuals may have. Trust-based relationships of these groups with their patients place them in unique positions to help support people in understanding vaccination. They will emphasize how getting vaccinated is honorable, which is a big part of Japanese culture, and that getting vaccinated will protect their families, especially their elders. If they encounter fervent opposition due to belief in Japan's traditional medical system, or Kampo, then they will explain that it doesn't have to be Western medicine or traditional medicine, but rather traditional medicine can be used to treat any side effects of the vaccine. We have traditional healers on our staff as part of our campaign who will work to address this issue. Finally, the community leaders will advertise the VaxAdvise app to the people they call. The VaccAdvise app is a convenient, no-cost platform that individuals can use as a general resource in regards to COVID-19 vaccination. The app has 4 main features. The direct chat allows users to chat directly with healthcare providers concerning specific questions or concerns they have about the vaccine. The scheduling feature enables users to create their own vaccination appointments directly through the app, and the vaccine locator identifies locations of nearby clinics and hospitals that are dispensing the vaccine. The locator will also show the location of the vans, and if individuals are unable to make it to a vaccine clinic or hospital, they can indicate that they need a van to come to them. These 2 functions will decrease barriers to the vaccine, which will increase the rate of vaccination. Finally, the community forum is a monitored public forum for individuals to share experiences regarding receiving the vaccine and managing side effects, as well as any other helpful advice or comments that they may want to share with others regarding the vaccine. After the end of the campaign, the app will transition from a COVID-19 vaccination resource to a general app for all vaccinations in order to decrease vaccine hesitancy in the long term.
Our clinics and vans will work in conjunction with the local hospitals to vaccinate the general public. The clinics and vans are distributed amongst the 8 regions in Japan. We felt that regional management would allow for more efficient distribution of the workforce and supplies. Vans are distributed based on land size, and larger areas get more vans. This is because vans are limited to the ground they can cover in one day. More populated areas get more clinics. However, since densely populated areas such as Tokyo already have more hospitals, they do not need a lot of our clinics. So we factored in a density factor. In Tokyo, for example, they have over 600 hospitals. However, in Hokkaido, there's only 4 major hospital systems, so they got a lot of our clinics.
These clinics will be located in community centers and religious establishments to cater towards people who may be hesitant about the COVID-19 vaccination. This will help to promote trust within the community. The image to your left is the Yujo Community Center in Tokyo, an ideal location where we plan to distribute vaccines. It appeals to a diverse group of people who may feel more comfortable coming here to get vaccinated rather than a hospital. Our Vax vans will reach isolated communities, older adults, people with disabilities, and those who do not have transportation. The social media campaign will spread the word about COVID-19 vaccine and its importance. At all vaccination sites, we will be distributing Shot of Honor stickers for people to wear after they receive their vaccine as their badge of honor. We will encourage everyone to take a photo after they receive their vaccine with the sticker and banner we have on site and post it to social media.
1 out of 4 people in Japan are 65 years or older. Our vaccination program accommodates the needs and eases the hesitations of people in this age group. Our app and phone campaign will address the specific concerns of older adults. According to a Japan-based study, 77% of older adults that are against or unsure about the vaccine are worried about safety or side effects, and 39% said that they don't know if the vaccine will be effective. Also, vans are crucial to the spread of vaccine to older adults that live alone, a number that is only rising with time. Households headed by people 65 or older will be 44.2% by 2040, and we're already at 36% in 2015. Lastly, the older adult population in Japan is an extremely active one. 70% of people in Japan aged 60 to 69 and 50% of people aged 70 and above are either working or participate in community activities and hobbies. Therefore, we are confident that older adults will attend our clinics as well.
We plan to evaluate the success of our program by administering a short survey via the VaccAdvise app and regular mail. The first expected outcome is to vaccinate 80% of the Japanese population by March 2022, which will help us achieve herd immunity. The second expected outcome is to increase vaccine confidence by 30%, so that 60% of Japanese people report vaccines are safe, important, and effective.
This is a breakdown of our $100 million budget, with the majority of our spending going to clinic staff. Thank you so much for your time.